There is something that some people don't think about that our medical system is going to, and that's electronic medical records and the systems and all the links and, those background factors that may not be something you do think about that I want people to be aware of, driven by insurance, by farm, electronic medical records being linked. All of these outside factors that when you're in when you're in the room talking to the doctor, you don't think about.
These patients seeking second opinions, it's very difficult for them to actually achieve that second opinion because of the fact that that doctor may be able to go in and read, and then they have this preconceived notion that you are crazy, that you are a drug seeker, that you are a bored housewife, as my mother was called, But when they have that preconceived notion and you have no idea, that is detrimental to your ability to get that true second opinion, because you want them a blank slate. You want to be able to walk in there and to explain what's going on and have them ask their questions without this bias.
Oh,
People need to
yeah,
be
I
aware
mean,
of it.
yeah, you don't. I think more people are knowing it exists now, but to what realm, I don't think we're aware of it and how that can impact us. Like you said, for wanting a clear second opinion, there was one doctor I didn't go back to because I felt like they were pretty much pushing it out on, depression, anxiety in your head kind of thing. And I was concerned that eventually, if I kept going to them, that they would write a diagnosis of a generalized thing that pushed it off on, psychosomatic in your head kind of thing. And I was afraid because I knew that they were a part of a medical charting system that once it was in there, all doctors across that hospital, connecting hospitals everywhere would be able to see that diagnosis. And I was afraid that for a majority of people, once you see that, you can't unsee it. And you maybe intentionally, unintentionally have that bias of thinking,
It's a big thing that people need to be aware of, and you need to be able to advocate. And so, just to impress upon the fact that going back and looking at your records and seeing what they are saying is going to be really important for you to be able to advocate for yourself best.
it's a system where things are supposed to be made easier for us, and some have, but there has been a whole lot of mess that comes with that. And I think this is why a lot of times medical gaslighting is even more fueled in today's system because of that connection. And while the system may be broken, you can still take control